of course, the pandemic that continues to trickle through here in the U.S. Just looking at the latest headlines on that front, we got some interesting updates. More states kind of reversing the course of these openings. You can look at New York and New Jersey as kind of the leaders here in terms of handling it well so far in terms of case counts coming down. But New Jersey announcing a cut to indoor gathering and the limits there that the governor has imposed, cutting that by 75% yesterday to 25 people after a spate of house parties there, led to some worrying, spreading super spreader events. You can call them super spreaders. They're super spreaders in my mind. When you get these cases, it was about 100 cases that came from those. New York also issuing violations to restaurants and bars for not following their own orders in social distancing, as well as serving diners outside. We got the update in Florida cases rising up 1.1% from a day earlier. That was compared to the average we've seen over the last week of 1.8%. So optimism there. And the overall nation's case count has continued to fall. Yesterday, it brought in the fewest number of new cases that we've seen since June 29th. So maybe reasons for optimism there. And for more on the current health pandemic we're seeing play out, I want to bring on our next guest, Dr. Jabraan Pasha, internal medicine physician at the University of Oklahoma Medical Center in Tulsa. Dr. Pasha, good to see you again. When we're talking about this, I mean, we're just chatting there about things moving in the wrong direction. In some states, the overall numbers may be pointing to improvement. What's your take on where we're at as we kind of get ready for, in a lot of places, if not all of them, the return for schools in the fall?
Yeah, I think, Zach, what we're seeing is different regions and different states even at different stages of the pandemic. And I think the hope is that states can look to their other states to kind of get an expectation of what's lying ahead. And if we can kind of take what's going on in some of the states that are being hit hardest right now, it may be some leverage for officials to really take precautions.
Yeah, and when we think about that, I mean, we can hope that that's the case that we'll see play out. There are still some states out there, governors resisting wearing of masks. And an interesting new case here to point to, specifically on the front of, I guess, worries of school resuming here. A case came from Georgia here, a summer camp there in Georgia, stopping short of requiring staff and kids there to wear masks. But the virus whipped through that camp, infecting I guess the numbers we have were those being tested, 600 campers and counselors. The CDC said on Friday, 3/4 of camp kids there and staff tested positive for COVID-19. So what does that say about what might happen when schools reopen? Is it that we're destined to see things like this play out, or does it speak more to why masks will be required if schools do reopen?
Yeah, a couple of things were startling with that case. One was just the sheer number, 260. Campers and camp staff tested positive. What was also startling was the fact that the age group between 6 and 10 was the group hit hardest, with 50% of the kids between ages 6 and 10 testing positive for the virus. And so as we look towards going back to school, I think we have the potential for super spreader events all over the country. I think one thing that can be taken from that is that camp did not mandate the kids wear masks, right? And so if there's some way to get 6 through 10-year-olds and older to actually comply and wear masks, I think there can be some hope that we won't see those types of numbers. But we know that it's hard enough for adults to wear masks, so you can imagine how hard it'll be for 6-year-olds to wear their masks.
I mean, it might be, who knows, it might be easier based on what we're seeing in terms of the squabbles amongst adults here. But when we think about that, that's very much front and center playing out at the highest levels of government right now. I just want to highlight what we've seen in terms of Dr. Fauci coming out in defense of his fellow coronavirus task force chief here, Dr. Deborah Birx. We saw President Trump tweet about this yesterday, talking about how potentially Dr. Birx may have been caving to the pressure coming from Nancy Pelosi there in terms of saying that more might need to be done. We're entering a new phase here. He tweeted about that. Dr. Fauci came back and saying that, no, she's right. We are seeing kind of what you're speaking to, different states come along here in different battles of their own. But what's your take on how that might undermine the medical advice here? Because we always worry about politics seeping into maybe, I don't know, listening to whether or not you should be taking a drug over some other treatment or all of that, or masks even. I mean, what does it say about kind of undermining the science here that should be guiding policy moving forward?
Sure, and I can speak specifically from a physician's point of view. No, we all take an oath, and our obligation is to the public, and our major concern is the health of the public. And I understand the political pressures on both sides, but the science is the science, and these are individuals who are very highly respected in their fields, and so my plea is for the general public to heed the warnings that come from these health officials.
I would be remiss too if I didn't highlight, obviously, you're in Oklahoma. We talked to you before the Tulsa rally that President Trump had scheduled there about what issues could come from that. We've talked about hospitalizations and how stretched some of these healthcare workers are out there. In terms of Oklahoma, we've been watching the case count rise there as well. So what are you seeing? Because all of this, I mean, you can look at a national number and that might seem fine if we see them falling. But if one small locality there sees cases start to spiral out of control, it does impact that healthcare system quite supremely. So when we think about what you're seeing on the ground there, how have you been able to, how have your peers been able to handle all of the case counts rising there?
Yeah, fortunately, over the last week, 10 days or so, our numbers have been relatively flat, and even with the last few days, seeing a little bit of a decline. But if you look at the general trend over the last several weeks, we're still trending up, and so our 7-day moving average line is still heading in the wrong direction. As you mentioned, we're just a couple of days of a surge from our hospitals really starting to feel the burden. And it's not necessarily the space issue, it's the staffing. And as our physicians and our nurses go out sick, our staffing is challenged. And so, we are kind of doing okay right now, but that can change really quickly.
I guess the other question there too. I mean, we've heard issues with PPE, all kinds of issues around this pandemic. You can kind of streamline it a little bit more. You think moving upstream and what you could do to change all this. Testing has been one of those major issues as well, where we're still going to be monitoring what could come out of these discussions between Republicans and Democrats. But Democrats through the HEROES Act pushing for about $75 billion additional spending to support testing. Republicans looking like they would allocate less than a third of that towards testing. So when we think about that, and really making sure that Americans can get their test results back and change their behavior if they know they have coronavirus. You think about how many cases might be reduced in terms of transmission here. How important does that become as a physician in kind of trying to minimize the fallout you'll see here in communities across the U.S.?
Yeah, I think that remains our biggest issue is testing. And there was a period where a lot of places across the country felt pretty comfortable in their testing, but that's kind of come and went. We're starting to see some backlogs of testing, and I've heard as recent as today, someone having to wait 16 days for their results to come back, which kind of goes against the point of being tested. And so, if you're having individuals that you just want them to wait till they get a negative result before they go back out in the public, and they're having to wait 2 weeks, chances are they may not heed that advice. And so, testing is still probably the major issue that we're having during this pandemic.
Yeah, and I don't know if more money being tossed at it will help here. Just the constraints that we've seen in a lot of these labs as we've been discussing on this show, always an issue. But Dr. Jabraan Pasha, appreciate you taking the time, internal medicine physician at the University of Oklahoma Medical Center in Tulsa.
Exactly.